Well, good morning. It's Bruce Williams again, sheltering in place here in Bethesda, Maryland. So I thought I'd put together another Gross Path challenge for you. This time, Gross Path challenge number 56. I hope you enjoy it. Slide number 1 is tissue from a dog. Can you give me a morphologic diagnosis? Well, there appears to be a large neoplasm in the mandible of this dog, which is extending from the gingiva down into the bone. We've lost teeth. It looks like this one is about to come out. There are a couple of good possibilities here, but what I want to draw your attention to is the fine granularity of this particular neoplasm. This is sort of characteristic of the neoplasms that they used to call the apulides. They have this fine granularity to them. And the one that burrows down into the bone that aggressively infiltrates but does not metastasize is what is now referred to as an acanthomatous ameloblastoma. Could this be another tumor? Could it be a melanoma? Certainly it could. Squamous cell carcinoma is another one that I would consider, but it's this fine granularity that we see in the apulides, which pushes me over toward acanthomatous ameloblastoma. Slide number 2 is tissue from a cat. Can you give me a morphologic diagnosis and a cause? Well, this is an absolutely fantastic picture of this entity. We are looking at the kidney of the cat. You can see the vessels on the outside of the kidney. Cat kidneys tend to be a little tan gold more than other species and have this prominent arborization of vessels. Now, when we look at white lumps on the surface of a kidney, there are two main rule-outs: lymphoma and the pyogranulomatous vasculitis that's caused by FIP, or feline infectious peritonitis. Now, the way to differentiate those two is to see if those white lumps are tracking along the vessels. If they are, that is the pyogranulomatous or lymphoplasmacytic infiltrate that's associated with the mutated feline coronavirus that causes this disease. These are absolutely tracking these vessels. My morphologic diagnosis would be pyogranulomatous. I'll take lymphoplasmacytic, lymphohistiocytic. I'll take any of those because no two cases of FIP look alike under the scope. Well, I'll say pyogranulomatous renal vasculitis with nephritis. And that's key to have both parts. This is really a vasculitis. Okay, this occurs as a result of the mutated feline coronavirus producing lots and lots of viral antigens. The body responds by producing lots and lots of antibody. It never really clears the virus. And eventually you get so much antigen and antibody combined, they precipitate out of solution into the walls of the vessels. And that's why this disease is so much a disease of vessels. Now, you always have this infiltrate which extends into the surrounding tissue. So I'm going to add the nephritis at the end. So a multifocal coalescing pyogranulomatous renal nephritis, renal vasculitis with nephritis would be the way to go on this one. And the cause is a mutated feline coronavirus. All cats have enteric coronavirus, but in certain individuals, and we don't know why, it mutates. And the mutation allows it to live within macrophages. Once it can live within macrophages, it can't be cleared, and that's where the chronic disease of FIP begins. Most parts of the body, it tends to be a vasculitis. In areas of the nervous system, it tends to be more granulomatous inflammation. That would include the retina as well. But this is a great case right here of FIP. Slide number 3 is tissue from a duck. Can you give me a morphologic diagnosis, the cause, and the name of this disease? Okay, time's up. We are looking at sections of intestine or possibly ceca. And birds have very interesting or waterfowl, they don't have lymph nodes per se, but they do have these large Peyer's patches. And they are circumferential around the gut, very selective. And there are certain diseases that hit the lymphoid tissue first before they start to lay waste to the rest of the intestine. And one of those is annatid parvovirus, or annatid parvovirus type 1, which causes the disease of duck viral enteritis or duck plague. Eventually, this duck is going to get a very severe enteritis, and it actually may have that. This may be a fibrant cast right here, and we're just not seeing a tremendous amount of hemorrhage and necrosis. This is a little more roughened. So fibrant cast and this very characteristic necrosis of Peyer's patches. My morphologic diagnosis will be focally extensive necrosis and hemorrhage of intestinal Peyer's patches. The disease is also known as duck plague, and it's caused by annatid herpes virus type 1. One of the only herpes viruses, one of the few viruses that you can actually see inclusions in the nucleus as alpha herpes viruses want to do, but occasionally in the cytoplasm of affected cells as well. Okay, slide number 4 is tissue from an ox. Can you give me a morphologic diagnosis? Well, this is a difficult one. We are up so close and personal, but we are in the abomasum. These are actually the abomasal folds. It's tough to really recognize them. And then we have these large ulcers. These abomasal folds are massively thickened by the influx of neoplastic lymphocytes. This is a case of lymphoma, and the abomasum in animals that are affected by bovine retrovirus is probably the most commonly affected organ. It's almost always infected. You get these ulcers. The animals can actually bleed out from them. There are a number of organs that are seen in cases of bovine retroviral infection that result in lymphoma. Abomasum is probably at the top. The uterus is commonly infected in cows with bovine retroviral infection. The heart is a really good spot, especially the left atrium, to find these tumors. So it's not a spontaneous case. This is viral infection, bovine retrovirus. Slide number 5, we're going back to a dog. How about a morphologic diagnosis and name 4 possible causes? Okay, time's up. If this was a cat, everybody really jumped to it, but with this very similar lesion in this dog, this is a distal aortic thromboembolus. Some people call these saddle thrombi. And you see them a lot in cats with a cardiomyopathy. You don't see them as much in dogs, and it's a sort of a non-specific finding of probably a diffuse process of vascular thrombosis in the animals. When we think about vascular thrombosis, there are 4 major causes. There are a lot of other causes, and I won't say that there's not. First one that I'm going to think about is corticosteroid over-administration or possibly a corticosteroid tumor. Corticosteroids inhibit tissue plasminogen activators that put the animals in a prothrombotic state. And so a great paper that was written by Tom Van Winkle back in 1995 showed that steroids and the second cause, pancreatitis, were major causes, at least in the retrospective study up at UPenn, of thrombosis, whether it's pulmonary thrombosis, thrombosis of portal veins, or these more rare thrombi. So pancreatitis, release of lipase into the circulation, will cause thrombosis. 2 other ones. A really nice one to remember is chronic kidney disease, whether it's glomerulonephritis or it's amyloidosis, anything that causes loss of protein through the glomeruli, and severe proteinuria is going to cause this condition. One of the things that is lost in these particular cases is antithrombin 3. Don't ask me what antithrombin 1 and 2 are, never heard of them, but antithrombin 3 will be lost through the glomeruli, it will pass out in the urine. These animals will be in a prothrombotic state. The last one is disseminated neoplasia or metastatic neoplasia of any time. These little boluses of cells can generate thrombi in multiple organs. So that's probably the fourth. There are a couple of other possibilities. I suppose that severe gram-negative sepsis could cause DIC and thrombosis, but it's not at the top of my list. The other thing I would mention is that if you have an animal that's in DIC and you've documented this over a period of 48 hours where you can watch the increase in fiber degradation products, you need to autopsy those animals as soon as they die, because when they're on their way out, not only the procoagulative but the anticoagulative system are going at the same time. So it's throwing thrombi, it's resorbing thrombi at the same time. And if you wait too long, you'll miss a lot of the thrombi. They will be light. Something this big probably is going to take a while. But the small thrombi that will help you make that diagnosis may disappear within an hour after death. So you want to get on those animals pretty quickly. Slide number 6 is tissue from a pig. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. We're looking at the kidney of the pig. The kidney does not look very good. It looks somewhat swollen. It is discolored. I got a couple possibilities here. Either it's a very olytic kidney, which could be, or it may be a kidney that is in the acute stages of pyelonephritis. But the kidney's not really what you want to look at. What you want to look at is the ureter and the periureteral tissue. I think that this is a ureter right here. I think most of what's going on here, this significant tissue damage and hemorrhage and necrosis going on outside of the ureter. My first choice for something like this is a large parasite which loves the ureter, the periureteral tissue, and sometimes the pelvis of the kidney in pigs, and that would be Staphylococcus dentatus. This is actually what this particular picture is, and this ureter is largely unscathed because the larvae and the adults have migrated into the periureteral tissue. They've caused tremendous granulomatous and eosinophilic inflammation and necrosis. So this is a granulomatous periureteritis, and the cause is Staphylococcus dentatus. The other thing that I would give serious consideration to would be that this entire thing is the ureter. Maybe there's a little bit of fat. I don't think that's the case, but it's certainly worth a consideration. And there are some very nasty organisms that cause cystitis, ascending ureteritis, and ultimately a bad necrohemorrhagic and suppurative pyelonephritis in pigs. The one that I would think about first is Eubacterium suis, which can do a tremendous amount of damage. So if you said that this was a suppurative and necrotizing ureteritis with pyelonephritis due to Eubacterium suis, I'm going to give you full credit on this one. Well, someone spent a lot of money on this bird and didn't get their money's worth. This is a cockatoo, and can I have a, let's just ask for the name of the condition. It's early in the morning. This is a tough morphologic diagnosis for anybody. So can you name a condition? Can you give me the cause? How about that? Okay, so we're looking at a cockatoo or citizen of some type. All of the feathers are clubbed. They haven't emerged from their sheaths. His beak looks a little gray, and there are cracks in it. And this is what we see with cytosine beak and feather disease caused by cytosine circovirus. And these feathers end up being clubbed. They're poorly developed. And if you look histologically at the down inside the pulp of the feather, you are going to see macrophages and perhaps some of the feather epithelial cells, which will have very large grape-like or botryoid basophilic inclusions, which are characteristic for circovirus. Boy, this condition went through a whole lot of potential agents until they identified porcine, I don't want to say porcine, cytosine circovirus a number of times. These animals also may have some beak abnormalities. The beaks may crack, pieces may break off, the tip may break off, and these animals just unfortunately don't do very well at all. There are some owners that love these birds and they take great care of them, but that's a tall order for most people who just wanted a fancy bird to show their friends. Slide number 8 is tissue from a cat. Can you give me 2 morphologics? 3 morphologics. Let's go 3 morphologic diagnoses. Okay, so one's a primary morphologic diagnosis. The other 2 are secondary to this. But the one that I would like is there is a large neoplasm, which is on the surface of the cerebrum. It is pushing inward, and this, as is really common in cats, when you open the cranium, about 80% of what you're going to see are meningiomas. They tend to arise within the leptomeninges. They initially face outward and they grow outward, but because the brain is encased in a bony shell, we call it the skull, they don't have a lot of room there, but they're going to continue to grow. They're going to butt up against that the cranium, and then as they grow, they're going to push the much softer brain material down. A second morphologic diagnosis is going to be compression atrophy of the cerebrum. You can see the entire midline has been skewed. There may be a slight herniation here of the lateral cingulate gyrus under the, I keep pushing this around, lateral cingulate gyrus underneath the tentorium cerebelli, the falx cerebri, which is a thin shelf of bone which separates the 2 halves of the cerebrum. And you can just barely see that lateral cingulate gyrus popping under there where it should not be. It's another morphologic diagnosis. The other one that everyone should probably get is hydrocephalus. Okay, you can see that the lateral ventricle is markedly dilated here. So we have an entire midline shift. We have the hydrocephalus, dilation of the lateral ventricle, and this large mass. If you look closely at the mass, you can see there's sort of a hard patterning to it. But this is a really good case of meningioma. Meningioma in cats, they tend not to infiltrate. Big meningiomas in dogs may infiltrate the underlying tissue, which makes it very difficult to excise completely. In cats, you can usually shell them out, but when you wait this long, I don't think that cat's going to do very well. Slide number 9 is tissue from a foal. Can you give me a morphologic diagnosis, a cause, and give me another affected organ? Okay, time's up. We're looking at a section taken at the periphery of the lung, and we have multiple coalescing pyogranulomas. I really only have one differential. If you're given that this is a foal, perhaps 4 to 6 to maybe even 8 months of age, and this is caused by Rhodococcus equi. If this was an adult animal, probably swap over to Streptococcus equi, variant equi, the cause of equine strangles, although well-seated infections, sometimes when you culture them, they've been taken over by Strep equi variant Zoepidemicus, which usually comes in and gets rid of Strep equi. They adapt much better to life in these microaerophilic environments. So in an adult animal, I'd probably say that this was a case of bastard strangles. But in a young animal, I'm thinking Rhodococcus equi. You know, these look really ooey gooey, and they don't look very much like the typical caseating pyogranulomas that we see. But, you know, TB is a related organism, and Rhodococcus don't get thrown because occasionally they will look like they have a very liquefied center. They will look like abscesses, but you're probably looking at Rhodococcus equi. A lot of these animals might have some form of immunosuppression, mild immunosuppression. And what happens is that 100% of these animals have pulmonary lesions. And then over time, they will begin to cough. And when they cough, they swallow it. And so they will swallow it, and it will travel down through the GI tract, and it will invade the wall of the gut over the Peyer's patches in the colon. So my second organ would be colon. They can get into lymphatics at that point and end up in the mesenteric or the colonic lymph nodes, which would also be an acceptable answer. So mesenteric, lymph nodes, colon would be great spots. About 50% of those animals have colonic lesions. Over the infected Peyer's patches, you see a very, very narrow opening at the top, and then underneath it tends to underrun. These are called volcano ulcers, very characteristic for colonic rhodococcosis. Then you flip that over, and you see that the very small lymph nodes on the outside of the colon, which you often don't pick up very well, are big, and they're full of the organism as well. Great case, Rhodococcus equi in a foal. And our last slide for this morning is tissue from a dog. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. Well, we're looking at the mesentery of this dog, and you can see that all mesenteric arteries are thickened. They're tortuous, they're rope-like, and they are white to yellow with streaking within them. And this is not a very typical presentation, but a great presentation of atherosclerosis. Whenever you see thickening of arteries, I want you to take a good look and say, is that yellowish or is it white? If it's white, it's probably mineral, and then we're off on a totally different set of rule-outs. If it's yellow-orange, it is atherosclerosis, and that color comes from the fact that when you get fat or triglycerides in the wall of a vessel, okay, macrophages will come in, they will start to break it down, and when you oxidize fat, it turns yellow. So atherosclerosis always has sort of a yellowish hue to it. I said that this is a great picture. Most of the pictures people have are in the heart, where it shows up really nicely. But you can see it in any artery of the body, and it's I've seen it everywhere from this to the prostate to whatever. 2 causes. And I really should have said, now the cause is, you know, a combination of hyperlipidemia, turbulence. You usually see it at the areas of turbulent blood flow, like where arteries branch, and then you have to have, of course, a break in that. So that's a real cause. What I was really looking for are 2 highly associated conditions, and those are hypothyroidism in the dog, where you have decreased activation of lipoprotein lipase. Idiopathic hypothyroidism or immune hypothyroidism is a condition that in a number of breeds starts as soon as like 2 to 4 months after they're born, and then by the time they're a year old, there's very little left of that thyroid. You have a pretty profound lymphocytic response, and over time it goes away, and there's just nothing there. And there's a wide range of breeds that you see that in. So that's number 1. The second one is diabetes mellitus. It often is associated with diabetes mellitus. So that brings us to the end of today's Growth Path Challenge. I lost my slides a little bit there. But I want to thank you for stopping by today. I really appreciate you taking the time to take these Growth Path Challenges. I hope they're helpful for you. And we'll see you again tomorrow with another Growth Path Challenge. Be safe out there.